All right, we are here at Dreamforce, and I have the esteemed privilege to speak with Dr. G, who is their Chief Medical Officer. So I'm here representing the patient perspective at Dreamforce. And I've been asked, why are you here? Because what business does a tech company like Salesforce have to do with healthcare? So as the Chief Medical Officer here at Salesforce, I bet you have some answers for us.
It's so exciting to see patients walking around Dreamforce, doctors walking around Dreamforce, and it's been a real privilege to be the Chief Medical Officer at Salesforce at such a historic time. We've all been through a lot, we haven't forgotten, and really we've been in the industry for over 20 some years, whether in the provider space, the med tech, life sciences space, but the reality is our agile, scalable CRM platform has a lot to offer the healthcare industry. Very similar to the digital transformation we've done in fintech, in manufacturing, in hospitality, in travel. Healthcare could use some of that, right? If we think about consumer relationship management, if we think about a platform such as Salesforce, we're trying to connect and scale the patient-doctor relationship. And we want it to be personalized, right? We want you to know that your doctor knows who you are. We want it to be a customized experience, and when and where you want it, whether you're walking your dog, whether you're on your bike, whether you're in your living room, or it's time to come into the office and see somebody like me. We want to be that glue that really connects and scale that relationship. And especially after the pandemic or in this next phase of whatever healthcare is going to look like, it's that much more important that we keep that trusted relationship.
Oh, thank you. Well, as a patient here at Dreamforce, my dream is that technology can actually help us as patients have a more seamless healthcare experience, which I'll tell you firsthand does not always happen. So I'm going to be looking towards you into the future to make sure that we're going to keep driving this forward together.
Well, that's why we call it Dreamforce, because this is where dreams come true. And we've got genies walking around, we got magic everywhere, but it really is about keeping an eye on the problem and not making, so much of what we saw also during COVID was technology was the enemy and social media was the enemy. And you and I both know that what technology, when used correctly, can be your friend, can be your guide, can be that connective tissue between the doctor and the patient. And that's our point of view, and that's our vision here.
Well, we hope while you do it that you can go ahead and make sure we're getting patient feedback along the way, so it is the best possible experience for patients now, their families, and for years to come.
Thanks, Jen. We'll be calling you.
Excellent. All right. Looking forward to it. So thank you, Dr. G, for having a little convo with us here at Dreamforce.